bit by bit, I will show images of a neurodegenerative disease, progressive supranuclear palsy or PSP, that was first classified as a Parkinson plus syndrome, but more recently is included in the frontotemporal dementias because there's also a problem with the protein tau, so it is a tauopathy. In PSP, there's marked atrophy of the midbrain, as you can see on this sagittal T1 weighted image, and of the frontal lobe, especially the central region, and widening of the cingulate sulcus. Patients with progressive supranuclear palsy have a vertical gaze paralysis that is caused by accumulation of abnormal tau in the interstitial nucleus of Cajal, located supranuclear to the third and fourth cranial nerve. And this interstitial nucleus of Cajal is the vertical gaze center. There's also abnormal tau protein in many other structures, such as the red nucleus, the substantia nigra explaining the Parkinsonism, the periaqueductal gray matter, and the nucleus of Edinger-Westphal that takes care of the pupillary responses. Sometimes there's not only atrophy but also high T2 signal, as you can see in the periaqueductal gray matter of this patient. The atrophy of the midbrain on the sagittal T1 weighted images gives the appearance of a bird with a very long beak and is called the hummingbird sign. Or you can also say it resembles a bird with very thick belly, so a penguin. On the transverse images, because of the atrophy of the midbrain, there is widening of the interpeduncular cistern and a concave dorsolateral midbrain border, giving it a Mickey Mouse appearance or resembling a morning glory flower. So the Mickey Mouse sign or the morning glory sign. The atrophy of the midbrain can also be quantified on sagittal T1 weighted images. And the first method was described in Neurology 2013, where they looked at the ratio between the area of the midbrain and the pons, which was about half. The midbrain was about half the area of the pons in patients with PSP, whereas in controls it was much higher. In progressive supranuclear palsy, there's not only atrophy of the midbrain, but also of the superior cerebellar peduncle. And if you take into account the superior cerebellar peduncle and relate it to the middle cerebellar peduncle, and you take the ratio of the pons, midbrain, and middle superior cerebellar peduncle, you might have a more reliable measure of PSP. And the same group who proposed this so-called Parkinson index updated it in 2018, and they also took into account the width of the ventricular system, making it even more sophisticated, more reliable, and more complicated to measure. The best thing, what is to assess the midbrain atrophy, and what is usually done in clinical practice, is just eyeballing it. So this is a normal midbrain with a convex border. This is a flattened border, so there is some atrophy. And here the border is concave, so there's marked atrophy of the midbrain. And you can also see that there's atrophy of the superior colliculus, which happens in PSP. Thanks for watching, and until next time, when we will discuss the most common cause of Parkinsonism, namely Parkinson's disease.